Hello, everybody. So it's 10 o'clock and we're going to go ahead and get started. Welcome everyone who has joined us on the call. My name is Carlin Raffi. I'm an extension specialist with Cooperative Extension at Virginia Tech in Virginia. And today we're going to hear a presentation about the Recovery Corps program, which is a really neat, innovative program using peer navigators for individuals in recovery through Americorp volunteers. But first, I'd like to just do some housekeeping. One, because it's a large group of attendees, we're asking that when you have questions or you want to make comments, please use our Q&A feature, and we'll be monitoring that and answering those questions as they come. We'll hear from all of our presenters, and we'll answer just a few questions after each presenter, but we want to leave the bulk of the questions till the end of the presentation. The presentation is being recorded, and that recording will be made available to you, as well as the presentation slides. We'll send those out at the end of the presentation. So just to give you an idea of where this idea of this presentation came from, myself and my colleague Emily Zimmerman are involved in a project sponsored by the Corporation for National and Community Service called the Participatory Action Planning to Address the Opioid Epidemic in Rural Virginia. This project is a 2-year project. We're in a little over a year of the project, and we are sharing the experiences of our community partners and stakeholders to address a local opioid crisis in Martinsville, Virginia, which has been really hit hard with the opioid epidemic. This is just a quick shout out to our team members. It's our Engaging Martinsville community team and research team, just to acknowledge them and the great work they're doing. In this project, we're using a community stakeholder method called stakeholder engagement in question development. We used this method to develop stakeholder conceptual models related to the opioid abuse issue in Martinsville and help those stakeholders develop priority questions, strategies, and policies in response to the issue, and facilitate the development of action plans and support initial action steps. Right now, we are supporting 4 work groups that are working on priority actions developed by this community. So now to our speakers. So I'm going to introduce each one of our speakers today first, and then we'll go ahead and let them talk. So first, you're going to hear from Lily Zandniapur and Shane Dermangian. Lily supports the CNCS's mission, programs, and policy priorities through the design, implementation, and oversight of research, evaluation, and capacity building activities, as well as knowledge management and communications. She's worked in the Office of Research and Evaluation of the CNCS for over 7 years and holds a bachelor's and a PhD in economics from American University. Shane is a Master's of Public Policy Management student at Heinz College of Carnegie Mellon University, who will be graduating this May. Congratulations, Shane. As part of his studies, he's completing a 1-year fellowship with the Office of Research and Evaluation at CNCS. And prior to attending graduate school, he served 2 terms with Americorp. His first was with Americorp Cape Cod, managing natural resources and educating communities about environmental issues. And his second term was back home in New Jersey, serving the SBP New Jersey, where he had volunteer reconstruction efforts of homes destroyed by Superstorm Sandy. So those will be our first presenters. Following that, Jake Scambati is going to provide a presentation about the National Civilian Community Corps. He started working with NCCC in 2015 and currently serves as the program's acting deputy director. Before coming to NCCC, Jake worked at several federal agencies, including the Smithsonian, the Inter-American Foundation, and Peace Corps. After graduating from college, Jake served 2 years as a Peace Corps volunteer in the Republic of Moldova, supporting their agribusiness sector after independence from the Soviet Union. Jake's professional and intercultural experiences helped shape his view on community development and leadership, especially the idea that every community can be transformative when you're serving others. And then our final presenter and kind of the focus of this is Ben Suker. Ben is a project manager at ServeMinnesota, where he is responsible for supporting efforts to combat the opioid epidemic in the state. He monitors project progress, coordinates action items, and tracks outcomes for the Recovery Corps program. Prior to joining ServeMinnesota, Ben worked at a local program evaluation consultancy, primarily with local and tribal governments on various public health initiatives. He holds a bachelor's degree from the University of Minnesota and a master's of public policy from the Humphrey Schools of Public Affairs. And so without further ado, I'd like to go ahead and hand it over to Lily and Shane. So Lily and Shane, if you'll share your screen with everybody. Okay, and we're not hearing you. So there you go.
Okay.
Okay. Thank you so much, Carlin and Emily, for having us today on this webinar, and good day to everyone. I think many of you are already familiar with the Corporation for National and Community Service, but for those of you who aren't, CNCS is an independent small federal agency that is the largest grant maker for national service, volunteering, and civic engagement in the country. Every year, thousands of Americans engage in service through agency-administered programs such as Americorp, VISTA, NCCC, and Senior Corps, and they tackle pressing challenges that our communities face. Programs that the agency supports are implemented in different locations across the country in rural, urban, and frontier areas, and cover a range of issues including education, health, economic opportunity, disaster services, environmental stewardship, and support for veterans and military families. As you know, one of the most pervasive challenges that we face as a nation is the opioid and substance abuse crisis. The epidemic is sort of enormous in scope and severity, and is affecting too many lives in the country. Since 2017, and as part of the administration's efforts to address this epidemic, CNCS significantly increased its efforts and investments in this priority area through our grant competitions and programming. Our work has always been in conjunction with our partners on the ground, including state service commissions, nonprofits, faith-based organizations, schools, and local agencies. Since 2017, the agency has invested somewhere between $14 and $15 million annually to address this crisis. The types of services and activities that these investments go to are really wide-ranging. Our grantees, sponsors, national service members, and volunteers are involved in drug abuse prevention and education, recovery, coaching and navigation, capacity building, safe disposal of prescription drugs through participation in drug take-back days, establishing coalitions, and prevention of relapse and recidivism. Today, we're so excited to learn more about Minnesota Recovery Corps that uses the Recovery Coaching and Navigation Program model as a strategy and approach to address this crisis. Our Office of Research and Evaluation is currently wrapping up an internal study that we've been conducting on this approach based on our funded programs in 2017 and 2018. The mission of our office is in part to build and use evidence to inform our work, advance measurement, and learning on our programs. Our goal with this study was to really gain a better understanding about these models and explore how we may measure their effectiveness going forward. A few people collaborated with us on this study that I just wanted to recognize for a second. Tia Renier, our Siegel Fellow, was critical in this work. Roshni Menon, Megan Johnson, Kyle Williams, and Anthony Norino have all contributed to this work alongside with myself and Shane, who will be speaking shortly. And I just want to take this opportunity and thank them for it. In 2017 and 18, the agency funded 16 programs that were implementing interventions that used Recovery Coach and Navigation Program model. And what I wanted to just define is by what we mean by recovery coach navigators. They generally have lived experience. A lot of times we talk about peer support, and by that we mean people who are in the same age group or have similar backgrounds. In this case, really when we talk about peer support, we mean people who have that kind of lived experience. And they can either be directly experiencing substance abuse disorder and are in recovery, or perhaps they're living in a family that has been impacted by the opioid crisis. So that said, I'm going to pass it on to Shane to tell you a little bit about these programs.
Sure. So this table here shows our 16 programs. There are 13 states in total, 2 in Virginia, 2 in New Hampshire, and 2 in New York, one of which is in New York City. So just geographically, you can see some concentrations in the Northeast and the Midwest, but they're by no means exclusive to those regions. So I'll just let you look at this table for a quick second. Okay. And sort of the served populations run the gamut. It could really be anywhere from homeless people to students to people currently in a treatment setting to people seeking treatment. Men and women specific programs, it really is all over. And the settings in which the service is administered is also all over. It can be anywhere from community-based centers and organizations to healthcare settings, law enforcement, housing facilities, educational institutions. It really is, again, they cover a wide range of settings and populations. So our key findings from what we've been looking at is that national service is a great fit for recovery coaching and navigating because of the lived experience component. So lived experience is integral to building trust and having the legitimacy required to be able to connect and guide the people with which the members are serving. With that lived experience, however, comes the need for proper training and support, because as some staff members and members have indicated in our interviews with them, that there is the potential for relapse. And with that requires the necessary training and flexibility for member schedules to be able to tend to themselves before they can tend to others. Furthermore, the model benefits both the served populations and the members themselves. And multiple members said how giving back was crucial in their own recovery process. So that's all we have.
So with that, we want to pass it along to Jake to talk more about our programming. As I mentioned earlier, we do rounds of annual sort of grant competitions, and also our service commissions and local, our grant makers locally do their own grant making in this priority area. That's something that folks can get to get information. So stay on the lookout for notices of funding availability for this work and try to develop projects on the ground.
All right. Well, I thank you, Lily and Shane, for talking about the broader resources available through National Service. A little bit of a different resource within the suite of National Service options is the Americorp National Civilian Community Corps program, or the NCCC program that we have here. It is a little bit different because it is not a grant program like we have with our other Americorp partners and Senior Corps partners. So Americorp NCCC right now, we are looking in the sort of indirect and prevention responses for some of the topics that we're talking about here today, specifically in the opioid crisis. VISTA and Americorp larger grant program and Americorp VISTA have had a much more clear path, or a much clearer path into that response. We believe our strengths lie in the indirect and prevention areas. So let me just talk a little bit about NCCC and why I think that is relevant here. NCCC is a team-based direct service program. We engage in short-term community service projects that help focus on a very specific direct service need from an organization, for a state, for a partner, for a community. Because it is team-based and because it is residential, so our team members will come from our regional office to the community to serve and live for either a 6 to 10 week service project. And these 10 members can actually make a very deep and significant impact in the sponsors or community's need. So if you imagine 10 members working 6 days a week, 8 hours a day, we have done great work in disaster recovery, in construction, in trail restoration for lots of partners. But more specifically here, I think these short-term projects through as you think about your comprehensive approach to some of the responses and needs in your community, we work well with nonprofit youth camps, YMCA camps, and help setting up and manage some of the needs of those camps. We are a great opportunity if you have construction needs for housing, for respite centers, for resource centers. We've done this for lots of different programs, and it may work well for some of the challenges that you may face or the responses that you've identified. Through the direct service component, we are able to really see big change and big movement, a lot of times in infrastructure or in the environment. And so as you consider how you move forward in this, NCCC could be that good resource for overcoming a short-term need and really seeing an infusion of high energy and service to respond to some of those needs. We also really see NCCC as being a good way to complement some of the larger national service requirements as you engage in the grant programs through Americorp and through Americorp Vista. NCCC can oftentimes come and respond to some of the needs that were identified through those grants or through the capacity building efforts of our counterpart programs. So that I think is something to consider. And what I would also say is that NCCC it's a leadership and service development program. This indirect way in which we engage youth that are 18 to 24-year-olds in professional development activities, service activities, and civic engagement is critical for creating alternatives to what they could be offered within their local community. Our mission is leadership development and strengthening communities. The leadership development, we have clear paths in which we develop leaders for 18 to 24-year-olds through our community service efforts. There are money for education or repayments of student loans at the end of a successful service year. We have clear pathways to employment through NCCC, which provide a wide variety of alternatives. There's tax certification programs that we run. There are engagement in construction and disaster response projects. We have fire teams that get Red Card certified, so they have options within the larger fire management field, and lots of different ways in which we see clear paths to employment. We have a sub-program within the NCCC program called FEMAcorp. FEMAcorp works directly with our federal partner at FEMA, and they run a program that is helping youth, 18 to 24-year-old young adults in our country, work in and get experience in the emergency response field. We have a very good track record of conversion from NCCC or FEMAcorp service into employment at FEMAcorp. I think we're at 32% now of all of our graduates are employed with FEMA, and so these alternatives are not direct response to some of the things we're talking about and that our other streams of national service do, but we believe we're a good complement to provide some of these indirect and preventative measures. Thank you.
We pass it on now to you,
Yes.
Ben.
Yep.
So there was one question that I think we can address now. And the question is, Shane spoke about flexible schedules for members with lived experience. And the question is, does that equate to shorter terms of service or part-time term of service?
Sure. So I would say with the programs that we spoke with, they would say I would say both, honestly. One program in particular said how members would serve 4 days a week, and then they would use the 5th work day to go to their own meetings pertaining to the recovery, or get their own, handle their own recoveries. But that could also, that long term, that does eventually then equate to a shorter term or a part-time amount of hours.
Yeah. And also sort of the emotional investment in this work is pretty intense. So, as much as you kind of want to do it, at the same time, you need to have that flexibility to step back and sort of regroup so that you're, constantly present and available to help. So those are all factors.
Yeah, and also I would say with the programs we talk to, a lot of times they would say that they are currently not flexible and they wish that they were. So I think it's sort of a work in progress for a lot of these programs.
I have another question. This one is a little bit more complex. Lily, this is for you. Maybe you can provide a few quick tips and then maybe get back with our questioner who says they manage a statewide Americorp program and statewide Americorp Vista program that focus on prevention and building resilience in youth so that youth can make healthy decisions and avoid opioid misuse and other substance use and misuse. And they would like to know if there are any suggestions for how best to evaluate these prevention efforts to determine effectiveness.
There are lots of actually ways that you can kind of measure sort of the awareness raising component, the knowledge that is gained through the programs and the sort of educational components of those programs that you can measure, skills, that sort of demonstrate how you can navigate the types of pressures and issues that folks face. All of those are kind of ways that actually mostly traditional methods of evaluation can help in measurement. But the thing that is very challenging, I think, is the measurement of the long-term kind of recovery piece, the outcomes of the programs in the long term. And that's one of the things that we are exploring, and we hope to be able to share more on that going forward, because a lot of the measurements, they ultimately kind of recovery is a lifelong effort, and it's difficult. There's no kind of a particular moment in time where you've achieved recovery. So it's an ongoing process, and ways to capture things like development of recovery capital over time, ways that you address all the mitigating issues that can help, stable housing, access to care, all of those things can play into the sort of bigger measurement about how effective a program is. And so those are some of the things that we're exploring right now, and our hope is in the coming year to perhaps conduct a more kind of robust study that looks at outcomes and takes into account every different way that these 16 programs have told us they're trying to capture and document their progress and how they're changing lives on the ground. So those are things that are sort of we're exploring and thinking about, and we'll share more on soon.
Thank you, Lily. There are a few more questions, but I think that some of these issues will be addressed by Ben in his presentation, and if not, we can get to them at the end of the program.
Great.
Okay, Ben, so I'm going to stop sharing my screen and let you share yours.
All right, can you see it?
Yeah, please put it in presenter mode.
How's this looking?
No.
Can you see my slides at all?
Yeah, we can see your slides. So
when I try to start the slideshow, nothing is happening. Maybe
if you've got a double screen, it may be showing, I don't know.
see, slideshow. How about now? You good?
The same. That's okay.
All right. I don't know what's going on. But you can see the
Yeah,
initial slide right here.
Yeah, we
Maybe
can
I
see
could
the slide.
just kind of zoom in as much as I
There
can.
you go. That's good. That's good, Ben.
There we go. And move this over here. Okay, yeah, so I'll be giving an overview of the Recovery Corps program, which is how we are utilizing national service to address substance use here in Minnesota. Just a quick introduction for me. I'm a project manager at ServeMinnesota, which is the state Americorp Commission. And my role here is to help think through program improvements and coordinate activities between the research and development team here at ServeMinnesota, and also with Reading and Math Inc., which is the national nonprofit that replicates Americorp programs throughout Minnesota and throughout the country, and is the implementation wing of the Recovery Corps program. Prior to starting in this position, I worked at a program evaluation consultancy where I worked primarily with two organizations, one of which was a local county that was enacting its statewide health and improvement plan, and then the other was the Great Plains Tribal Chairman's Health Board, which is an organization representing 18 tribal communities in the Dakotas, Nebraska, and Iowa, doing work around improving cancer prevention initiatives. And as this presentation is really designed to explain the value of national service and Americorp, I would be remiss if I didn't mention that, like Shane, I served 2 terms as an Americorp member myself, doing work around dropout prevention, and then serving as a VISTA member, building capacity at an organization that was supporting programs for opportunity youth, or folks that are 18 or 24, currently unemployed or not in school. And I've always had an interest in health and wellness, especially at the larger systems level. So being able to work in this position, one that allows me to really work towards addressing substance use and support the Great Recovery Corps program, is very much a prized opportunity. Let's see. So just a brief overview of what I'll be going over the course of the next half hour or so. Starting with the beginning and evolution of Recovery Corps, and then providing some answers to questions around the program, like what members do, where they serve, what data we're collecting, and then concluding with a brief discussion about where the program is going in the future. So like was kind of mentioned at the top of the presentation, Lily was talking about how CNCS really put a call out for programming, identifying the opioid epidemic as a problem that could be addressed by deploying Americorp members in some way. But before deciding where we should really plug in at ServeMinnesota, we first had to know what the biggest need was in the state. And going off that, Minnesota is well known for having well-established treatment centers and has really led the way in this area. But something that we found out early on is that there are fewer supports and less funding for recovery strategies outside of that treatment setting. So we knew right off the bat that there was a critical need for recovery supports, and that's ultimately where the focus area became. Additionally, we soon came to realize that there was a very natural fit between recovery and Americorp, kind of a symbiotic relationship that went both ways. So as it relates to members in recovery themselves, an adage that you kind of hear repeated in the recovery community time and time again is that when it comes to recovery, you have to give it away to keep it. And being in recovery teaches people the joy in serving others, which is something obviously that Americorp is all about as well. And then conversely, we're finding that people who are in recovery are uniquely positioned to succeed as Americorp members, as they've demonstrated ample resourcefulness and resiliency in navigating their own personal recovery journey. And you know, these characteristics are important to have in any position, but especially so in an Americorp one. And as mentioned earlier on in the presentation, we're finding that the service does have a positive impact on Recovery Corps members. We issued a survey to our members last year, and 100% of them either strongly agreed or agreed that their experience as a Recovery Corps navigator strengthened their own recovery. In this graphic, this kind of shows how states are spending dollars that were authorized by the Comprehensive Addiction and Recovery Act just before our Recovery Corps was established, and really demonstrates that most of the funding towards this problem is going towards treatment and prevention, and the issue area of recovery is sort of ignored, especially so in Minnesota. If you were to zoom in on this screen as much as your computer allows, you still really won't see that sliver of green that represents recovery funding. So that's how it started. And the beginning of Recovery Corps, the initial plan was to leverage Americorp members to work with people in recovery with a primary focus on helping participants find employment, knowing that employment is often an ingredient for success in sustaining recovery. Big reason being for this focus was that we already had the infrastructure in place to support this kind of work with another Americorp program, Opportunity Corps, which is a program designed to assist individuals with barriers to economic self-sufficiency by helping participants access resources and build the skills necessary to navigate employment and or education needed to achieve that economic stability. And after this first year, we received a lot of positive stakeholder feedback, but we also learned that employment was a limited goal, and the needs of people in recovery are very diverse. You know, some people need help with finding healthcare or information related to general health and wellness, strengthening relationships with friends or family, finding education, and accessing safe and affordable housing. So the subsequent 2018-2019 program year, Recovery Corps evolved into what it is now, which is utilizing Americorp members in recovery to provide those peer recovery coaching services, which are a set of non-clinical activities based on shared lived experience that engage, educate, and support an individual to successfully recover from substance use disorder. And a question that we get asked a lot by people kind of unfamiliar with the world of recovery is how our members really differ from what people kind of think of as traditional counseling or licensed and alcohol drug counselors, for example. So I just briefly like to note some key differences here, but so much of it really does come down to just that peer aspect. So as this table shows, peer recovery coaching relies on experimental knowledge versus formal education. There's a minimal power difference in that recovery navigator and participant relationship. And also our navigators really strategically use their own story to help motivate people in recovery. And lastly, our navigators support multiple pathways of recovery as opposed to really adhering to one particular organizational philosophy like LADCs might do. Our Recovery Corps navigators are role models and mentors. They've walked the walk and can really offer their own life as an example of healthy living. They are resource brokers that provide linkages to the recovery community and offer other support needed. They know the system of supports and how to navigate those, and often have established contacts and recovery partnerships in the community. They're problem solvers that assist people in non-judgmental ways. And lastly, yeah, they're motivators and cheerleaders that can encourage hope and optimism and celebrate successes that the participants that they're working with have. So this next slide really kind of takes a look at what our theory of change looks like. So recovery navigators, they work with folks on a recurring basis to identify areas of recovery capital to build, and then provide that individualized planning support, goal setting, and action planning to get individuals connected to resources such as training, education, service, or employment opportunities, with the ultimate goal being an increase in recovery capital. And recovery capital really is just that whole collection of resources that a person uses to facilitate and maintain the recovery. It's kind of broken down into these 4 boxes that you can see here, with social capital encompassing things like family, friends, community relationships, physical capital, so things like property and money, human capital, skills, positive health, aspiration, hopes, and cultural capital, values, beliefs, and social attitudes. Research does show that the more recovery capital an individual is able to access, the less likely it is that there will be a recurrence in substance use. So we ensure that navigators are equipped with the skills and knowledge to succeed during their year of service by offering the following trainings throughout the service year. We offer a Recovery 101 during their first week, where navigators learn things like recovery terminology, brain development, co-occurring disorders, trauma and recovery, and history and cultural context of illegal drugs. The Recovery Coach Academy, which is really the crux of the training that members receive. It's a 46-hour program offered by a local recovery community organization that teaches navigators the key concepts, fundamental skills, and core functions of being effective in their role as a recovery coach. Motivational interviewing, which is the counseling style for changing behavior by helping participants explore and resolve ambivalence. We bring in experts from the community to discuss knowledge of key areas of recovery capital and local resources around housing, employment, health, and reentry. We have an ethics and boundary setting training for members. And there is a diversity, equity, and inclusion training to ensure that members are able to provide participants services that are delivered in a way that acknowledges different perspectives that participants might have. We want our members to be really knowledgeable about kind of the local ethnic or cultural communities in the areas that they're serving in, and also maybe some other like indigenous healing roles that may be engaged as sources of recovery supports. And lastly, there are periodic core days throughout the year where members are convened, engage in additional professional developments. Where do Recovery Corps navigators serve? So we have 17 current Recovery Corps navigators serving at a variety of nonprofit sites, things like collegiate recovery programs, outpatient treatment programs, recovery community organizations, which are led by representatives of local communities that carry out recovery-focused community education and outreach programs and also provide those peer-based recovery services, recovery high schools, sober living environments, and state agencies. As an example, the Department of Corrections, who is one of our site partners, assists individuals and connects them with community-based recovery support upon release from incarceration. Moving on to data. So just a quick note about data, which is although recovery coach interventions are being implemented nationally, there's currently limited data to support their impact. So it's an exciting opportunity really for us to add to what is now a relatively small research base and really figure out how to demonstrate the value that these services have, both on participants themselves and the community writ large. So our navigators collect things like demographic information, a recovery capital score, which is a 10-item assessment, BARC 10, or the Brief Assessment of Recovery Capital, developed by Dr. John Kelly from the Recovery Research Institute at Massachusetts General Hospital and Professor of Addiction Studies at Harvard Medical School, that encompasses health, housing, education, employment, social relations, and purpose in life. Kind of see it as analogous to taking a person's emotional pulse. We have a short quality of life questionnaire developed by the World Health Organization, self-reported substance use. So we know that recovery embodies more than just the cessation of substance use, but it is still an important measure to have. And then finally, we ask for one-item assessments for self-esteem and self-efficacy, which is the belief in one's own ability to remain substance-free. So after members collect all this data, the next logical question might be, where is it stored and how is it used? And the answer to where it's stored is in a secure and customizable database called NAC, which is HIPAA compliant and relies on data encryption to ensure that the data for participants are now not accessible to anyone aside from the navigator themselves and the Recovery Corps program. it's a great software. It's not cookie cutter in any way, and we're kind of able to set it up to align with our specific program needs. And navigators themselves, they can use it to create tables, charts, and reports to see trends, compare numbers, find patterns, and show progress on a participant's recovery journey. So kind of an example of how this might play out. So we can isolate any of the measures that we gather. So a navigator might notice a drop in the how satisfied are you with your transport question, and then use that to spark a discussion about what's going on and find out how that might be able to be resolved in some way. And then you would see at the next instance that person has with a Recovery Corps navigator, that score would move up. This database is also linked to an internal analytics dashboard that provides interactive visualizations that I will show briefly right now. So this is a Microsoft Power BI dashboard, which really allows us to slice and dice the data to isolate any of the measures that navigators are reporting on. And we can use it from a program side to really satisfy any sort of curiosity of the program that we may have. Doing this kind of allows us to see what makes each site unique, like at Pease Academy, for example, which is a sober high school and isolated here. We could determine maybe if there are more group versus individual sessions that a navigator has with participants, or maybe a navigator at another one of our sites saw their participants increase their self-esteem scores in a greater degree relative to other sites. So we could learn from that member what they're doing that makes them so effective, leading to this promising results. I won't get into the data too much, but I just wanted to show this graph that I think really demonstrates the value of the Recovery Corps program and the services that the Recovery Corps navigators provide. So this one shows the relationship between the percentage of participants who saw an increase in their recovery capital score and the number of times a participant met with a navigator. So we see that the more times a person meets with a navigator, the more likely they were to build the recovery capital, thus increasing the likelihood or probability of that participant remaining substance-free. So I have the slope coefficient shown here that just kind of tells us in practical terms that for each session that somebody has with the navigator, the percentage you saw an increase on that y-axis there goes up by 2%. So changes to the 2019-2020 program year, the biggest change that we made was really related to data collection. We heard from members last year that there are challenges related to timely data collection, and that it can often feel intrusive or sometimes detrimental to that peer-to-peer relationship. So we really made a concerted effort to focus on value and ease by combining all of our forms into a single front-back page that is expected to be filled up by participants each time they meet with the navigator. So last year we had a number of different forms that were expected to be filled out at varying intervals, which just kind of added a layer of confusion. So this year we really have that expectation of data collection at every session, and we're already seeing an uptick in participants being served on a recurring basis, which is exciting. We also made changes to the demographic form to really better understand the people being served by our navigators by adding questions related to primary substance that a participant is in recovery from, criminal backgrounds, immigration or worker status, veteran status, what, if any, public assistance programs a participant utilizes, current housing situation, geographic location, means of transportation, and primary email address. So we can follow up with participants after they're done working with the navigator to even understand further how working with the navigator affected them. And I've included a screenshot of what this looks like on that aforementioned internal analytics dashboard. So these new additions can allow us to see a lot of new and interesting trends, maybe about where the greatest need might be in the metro area where the majority of our navigators are serving. Drug trends by different regions. So as we look to maybe expand throughout the state of Minnesota, we can see how primary drug of choice might be different in northern Minnesota versus southern Minnesota. So it could really show us a lot of interesting things. It could also show us maybe whether a particular sites are working with a disproportionate amount of immigrants compared to other partner sites. So again, the more we learn about participants, the better able our navigators will be able to serve them. And this is just a graph showing our year 3 preliminary data. So this shows, again, similar to this graph shown a couple slides ago, but shows that relationship between percentage of participants who saw an increase in their recovery capital score and number of times a participant met with the navigator. And it's exciting to see we already have a larger sample size than last year, and we see an even steeper relationship between these two things, which is a promising result, and kind of shows that the changes that we made this year might be paying off. And then just going forward, so we know that Recovery Corps is addressing an area of critical need and that the solution is aligned with empirical evidence. And we also know that the concept of utilizing peer recovery coaching lends itself well to the use of Americorp members who are in recovery themselves. So our focus now really is expanding the program, both in the Minneapolis and St. Paul metro area, but also into greater Minnesota. And we're doing this by researching and identifying which areas of the state have the biggest need and leveraging our current partner networks to make connections and also to build relationships with statewide boards who are working in this area to really have those key external stakeholders out there that are able to champion the program and kind of spread awareness of what's working. And we're also constantly working internally to make sure that the technical features, such as our data management systems and training infrastructure, is tightened up so that as Recovery Corps looks to scale and sustain, we have policies and procedures in place that will allow us to do that. We're also exploring new partner sites. So like Shane mentioned earlier on, some Recovery Corps navigators, they work in hospitals in other states. So that's kind of a next area that we want to explore. And there's just so many other kind of points along the recovery care continuum that we could plug into. So always looking to form new partnerships there. And we also want to make sure that what our program is doing is aligning with that community need. So Carlin was mentioning earlier on in the presentation about the stakeholder engagement and question development and prioritization model. So we're using that right now with the aim of gathering input from the people most affected by substance use in Minnesota to really understand what those needs are and incorporating those into our programming. And we're always looking to raise program awareness by sharing our program with interested parties, such as all of you on the webinar today. We love talking about all the great work being done by the Recovery Corps program and the navigators that are serving. So just one more thank you to all of you for kind of taking the time to learn more about Recovery Corps today. I've included a website if you want to learn more, and would definitely encourage you, any of you, to reach out if you want to discuss further. On the title slide, my email is there, so definitely don't hesitate to reach out if you want to learn more. And I'll turn it back over to Carlin to maybe spend these last 10 minutes to take some questions.
Great, and we have some great questions, so I'm looking forward to answering those. So Emily, if you'd like, if you want to take the questions that are in the Q&A, and I'll read out the questions that are popping up in the chat box.
Okay, great. So one of the questions is about service coordination for these programs. So can you tell us a little bit more about the service coordination? And also, can the programs focus on other healthcare prevention activities, such as diabetes prevention programs?
Right now, the scope of our program is really focused on recovery. I should note too that the Recovery Corps program director is also a panelist, Alana Stimes, and she has the ability to share her microphone and answer some of these questions. She's more involved, with the day-to-day operations of the Recovery Corps program. So Alana, if you want to hop on and take any of these questions too, definitely feel free to.
Most certainly, I'm happy to help. Hi, everyone. My name is Alana Stimes. I'm the director for Recovery Corps in Minnesota, as Ben so nicely outlined. I think most of the questions that I see in the Q&A as well as in the chat that particularly might be related to Recovery Corps might have been right around that 9:30, 9:35 time slot. So I'm not sure, but maybe those first three questions submitted by Patricia and Jennifer may have been also asking of our former speakers as well. So I don't know if they would like an opportunity to answer those, but I can certainly answer anything related to the Recovery Corps program.
So Alana, do you want to mention about the service coordination for the programs? And also there's a question about finding clients for those programs.
Yeah, so I saw a few questions related to recruitment, both of members as well as clients. We really lean on our site partners, those kind of recovery residences, collegiate recovery programs, and on that slide that Ben outlined, where there already is a base of people who are themselves in recovery and ready to build their recovery and kind of strengthen their recovery further. And so sometimes our recovery navigators are doing some outreach, helping to advertise the services that they're able to provide, but we really work in collaboration with our partners to be able to serve communities who really need that extra recovery support, and we identify those sites through a site application process. In terms of recruiting members, we are really looking for individuals who are themselves in recovery, so that is a requirement. I saw that question asked quite a few times throughout the presentation, and we do require that those individuals have a minimum of 1 year of uninterrupted recovery kind of under their belt. So that would be the big requirement when we are recruiting. I think it's such a really interesting topic, and as Ben alluded to earlier, we have like service is a pillar of recovery, and so from a recruitment standpoint, we have a lot of interest from people within a variety of communities across the state who are excited to serve in the program.
So I have a question here about the financial resources that are used to cover the training costs for the Recovery Corps individuals.
That's a great question. So our members obviously do not pay for any of the training and professional development that Ben outlined this morning. We utilize the grant funds that we receive through the Corporation for National Community Service and within our partnership with ServeMinnesota to be able to cover all of the costs related to any training that we require them to attend.
There's a couple of other questions, and I actually have a question about related to any restrictions on where these individuals can serve. So one Laurie asks, can they serve in local health departments? And I'm also interested to know if there are any restrictions about the types of organizations that can apply for Americorp volunteers to establish a Recovery Corps program. For instance, religious and faith-based organizations.
Well, those are two great questions. So I can answer that second one first. The types, there, from an Americorp standpoint, we need to be serving kind of communities in need. And so all of our partner sites are required to be a 501c3 or nonprofit entity. So Americorp in general would prohibit partnerships for the most part with for-profit agencies. And hopefully I'm not making anyone from CNCS on the line, I don't know, roll their eyes at me, but so that's kind of just where are the sites in need who maybe wouldn't have the other resources otherwise to be able to offer a service like this. And then certainly being able to partner with a variety of agencies has helped us as a program to learn, are there settings that are really well positioned to host recovery navigators and grow their focus moving forward than others. And I think right now we, as Ben kind of showed earlier on one of the earlier slides, we're partnered with a variety of organizations. We certainly aren't limited to partnering with like a health organization, and I think we're looking in that direction as well. But certainly some other community-based nonprofits, state agencies, and then some of those school settings, as Ben mentioned too.
Great.
This is Lily. I saw a couple of questions in the chat box around trainings, and I just wanted to chime in on that one and say that based on our sort of study that I was referencing, we find that motivational interviewing is one of the most commonly used recovery intervention trainings that members get training on. This is all in addition to all the trainings they receive as Americorp members to engage in the work. But that's one where many use. There are also several grantees of us that utilize the addiction recovery training resources from the Connecticut Community for Addiction Recovery. The motivational interviewing one that I was mentioning is offered through SAMHSA. That's one place that you can access that training. There are also other trainings like Seeking Safety is one training program that trains non-professionals that are sort of helping individuals to help recoveries deal with co-occurring PTSD and substance abuse, and it's an evidence-based training. There's screening, brief intervention, and referral to treatment, what is known as SPURT, is another evidence-based training that is used by a few of our grantees. Then other types of training models that have been referenced by our grantees in their work include like community health worker training, which is a free online training. Virginia Commonwealth University's peer recovery support specialist certification is another one. McShin Foundation has a 16-hour recovery coaching training. And these trainings are, some of them are online, some of them are workshops and intensive in-person training. So there's a range that our grantees across those 16 programs that I mentioned are using to prepare service members to engage in this work.
Thank you, Lily.
Mm-hmm.
There's another question here from Patricia. And I think Patricia's questions are related to Recovery Corps. How do you manage the transition once your AC Recovery Corps coach finishes their service year so the relationship with the person in recovery is not compromised?
Patricia, that's a fantastic question. And I think that that's just a real area for growth for many Americorp programs, no matter what focus area that they're in, that programs kind of have to think about from a design standpoint, because sometimes there is a small gap in services. And if a member decides not to continue into a second year with the program, that relationship really has to have an intentional and warm handoff. So we've been working very closely with our partner sites on really kind of being that bridge in the interim as we get a new recovery navigator onboarded and being able to kind of carry out that work. A lot of the training that we provide for our members, the majority of it really happens at the very beginning of their service year as well. So they are starting to at least learn all of the things that they will need to be able to do and start implementing in the field right away. And that allows for them to start kind of building those relationships and building that rapport as soon as possible once they get to their sites. But it can be definitely an area for growth.
Emily, do you have anything from the Q&A?
Yes, I think that this might be a question for Ben about whether there's been any assessment of the efficacy of the recovery coordinator meetings compared to other interventions such as traditional counselors or just unofficial support persons without lived experience.
There has not. I mean, it would be really good to kind of do that sort of comparison group study to see what that would look like. So definitely have that in consideration when we engage in our next evaluation.
There's another question about where the recovery mentors meet their clients, whether it's a centralized location or they're just out and about meeting their clients in a mutually agreeable location.
It's a great question. We really try to centralize all client interaction and all client meetings with our recovery navigators within that site setting. Our members' positions are all hours-based. They're through an Americorp state grant. It's just something that we need to make sure that what they're doing is supervised and supported. And so, we really encourage our clients served by recovery navigators to be meeting within that site space. We require all of our sites to have a confidential area where they're able to meet their clients and things like that. And so right now, most of those interactions are happening within that site scope.
And I have a question for Lily. A couple of people have asked about Americorp volunteers being used to target other health priorities. There was the one about the diabetes program. What are there Americorp programs that are targeting other health priorities, and where can people learn more about that?
They are. I mean, they're, as I mentioned earlier, I mean, the healthy futures and health is one of the focus areas for our programming, and so there are many members of, throughout different years of funding that have been deployed to work on these issues. In terms of where to read about them, I mean, we on our end compile information based on kind of the research studies that have been done on them. So our evidence exchange is one resource that folks can consult. I'm not exactly sure about, how much information is there regarding these particular interventions, but members in general have a lot of, engage in a lot of activities, non-clinical, that involve various types of health issues.
So it is 11 o'clock. That's the time for our for this webinar to end. I think we can stay on a few minutes more for those who can hang out for just to finish up a couple of these questions, but I wanted to let everybody know who needs to get off that you will be receiving an automatically generated short post survey. We would appreciate if you'd answer that. I have our contact information here on this last slide. So Lily's information there, Ben, and then Carlin and I'm Carlin, and Emily's information. If you want to contact any of us, please feel free to do so. We will also be sending out a post-program email to everybody with the slides, as I mentioned before, and a link to the recording, as well as we'll go through these questions that are in the Q&A and chat box, and any that we're unable to answer in person, we'll provide answers to in that email. Appreciate all of you who've joined in. And if you need to get off, get off. If not, I think we'll just maybe 5 more minutes to see if we can get a couple more of these questions answered. Ben and the others, I have just a quick question. If a person wanted to establish a Recovery Corps program in their state, what first steps should they take? And that's for anyone who thinks they can answer that question.
This is Alana. I can at least say what I would say. I think that if you're able to work closely with your state office or state commission in kind of talking through what possibilities could be, I think that's, we're, so closely partnered with ServeMinnesota, and we really work together as part of a design team to think through the critical need in the state, as well as what implementation could and should look like tailored to the communities that we're really interested in serving. And so if that state commission or state resource is available to you, I think that would be where I would say a really great place to start would be.
Great, thank you. Emily, are there any other questions that we should answer before we conclude this webinar from the Q&A?
Sorry, I think there's a couple quick ones here. Alana might be able to tell us, how long are participants typically working with a recovery member?
Great question. We really emphasize, as Ben showed with some of the data points, that a client would come and work with a navigator a minimum of 3 times, because we know that once they kind of hit that 3 or more times threshold, their recovery capital scores really do just start to rise and get a lot stronger. And so, but how long 3 sessions might take for one person might look very different from another. So it's kind of hard to say, an average time length. We could certainly go back to our data and kind of see what we're seeing on average. And maybe Ben already knows that, but what I would say is, I might take 3 months to meet with somebody 3 times, and somebody might be able to meet in 3 weeks. And so as long as we're cultivating those relationships, building that rapport, and really having our navigators focus on bringing people back through the door, that's how we're really able to deliver those strong services and building that recovery capital for the folks that we're serving.
And do navigators focus on the barriers related to the negative stigma attached to mental illness or opioid addiction?
Can you repeat the question?
Whether the navigators focus on the negative stigma that could get in the way.
Yeah, I think a lot of the training that we offer for our navigators talks about stigma, talks about trauma-informed care, talks about all of these things that we know kind of surround the recovery space. And we're called Recovery Corps for a reason, because we really want to partner with folks in the communities to promote that really positive message about all of the gifts that a life in recovery can bring. And so, yes, there's stigma, and how can we really utilize this as a positive and a very like forward-moving focus for our programs? So they acknowledge it and really kind of promote that positive messaging around recovery.
And I have one more question here. What role might volunteers play in this process? So I'm thinking they mean non-Americorp volunteers.
Yes, I would assume that as well. You know, a lot of our sites use volunteers in a different way, or may not use volunteers at all, depending on the type of site that they might be. We've seen volunteers be able to do some smaller tasks, like maybe phone supports or things like that, that can really just kind of augment the whole model in general. So I think that there's smaller volunteer roles, maybe in a more traditional sense, where people could still get involved. But obviously, we would really be promoting that full-time service term opportunity for anyone interested in our program.
Wonderful. So I think we're going to go ahead and stop it there. I want to thank all of our panelists. And we'll be reaching out to you. I think you have some resources when we send out that email to all the registrants, maybe some resources we can provide them in that email as well. Thank you again for your attendance, and look for an email from us. Have a great week, and I hope this information has been informative and help you potentially start something in your own community.
Thank you, Carlin and Emily.
Thanks.
Thank you so much.
Thank you. Bye-bye.
Bye-bye.